Across the globe, people are dying. It's always very, depressing having to tell a family that they've lost their loved one. It hurts a lot, really. And, we just try to always do our best as doctors, as medical practitioners. It's not easy. It's very difficult, but we always give it our best.
It's hard to imagine the physical, mental and emotional strain that comes with battling to save lives. Yet for the first half of the year 2020, the round-the-clock pressure countless medical personnel all around the world have been dealing with has more than doubled. Reports show that while thousands have experienced psychological breakdown, more than 3,000 health workers worldwide have even lost their lives while trying to save those of others. Yet, refusing to give up, these frontline soldiers selflessly battled on to win the war against the greatest health threat of the century. An epidemic that broke out on 31st December 2019 in Wuhan, China, quickly became a pandemic that brought the world to its knees. Irrespective of race, culture, or social status, people all around the globe faced the same fate in the months that followed: isolation, loss of loved ones, loneliness, fear, panic, and worst, an uncertain future.
COVID-19 has a very devastating impact on every aspect of the human race, be it economy, be it health. In some places, it has overwhelmed their healthcare system.
This is a new kind of virus. It has a new and devastating impact on public health systems of all countries. In our case too, we have also worried about our health system, whether it's going to be able to withstand the onslaught and the force. So what we have done is to prepare ourselves for the worst, but strive for the best.
But what Nigerians dreaded happened. The coronavirus disease had broken through the borders of the country. On the 27th of February 2020, the nation's first case of the novel virus was confirmed in Nigeria's commercial capital, Lagos. The case is a 44-year-old Italian citizen who had just flown into the country from Milan, Italy. As Nigerians desperately looked to the federal government for answers, the Nigeria Center for Disease Control, NCDC, stepped in to proffer solutions. NCDC is Nigeria's National Public Health Institute, responsible for the health security of Nigeria through the prevention, detection, and control of diseases of public health importance. It is modeled after the US CDC and runs much like other countries' institutes, which serve as focal points to protect and improve health for the country.
One of the major functions of a National Center for Disease Control anywhere in the world is to be prepared for the unknown. So once we got into this position in 2016, we brought in peers from other countries, evaluators, scientists, to look at how we were doing. And we opened our books for them. We opened our labs, our surveillance system. We weren't where we wanted to be. So we had started improving on many of those criteria that we evaluated ourselves on. We had improved our labs. We had a very strong national field epidemiology laboratory training program. So we started building capacity across the organization, our organizational functionality and all of that.
All the work that we have been doing before now basically has laid a foundation for the work that is going on currently now. We were now at 37, 38 labs, but initially we started with 4. So there was already an established system for us to begin with. If we didn't have that initially, it would have just been us starting from ground zero, from scratch.
Leveraging on its already established health emergency response system, NCDC quickly deployed all its available resources at the state and national level to end what it considers a level 3 outbreak, the COVID-19 pandemic.
The first thing we did was to set up a group called Technical Working Group. And this technical working group comprised of all our partners and all the stakeholders. So we started, preparing, developing guidelines on every area of IMS. IMS means Incident Management System.
We've used this incident management system structure to mount successful responses to Lassa fever, responding to cerebrospinal meningitis, responding to monkeypox, responding to measles, name it, all the outbreaks we've had so far in the country. And currently, this is exactly what we're using for COVID-19.
Thankfully, the NCDC's recorded success in dealing with disease outbreaks in the past and its dedication to protect the health of its citizens was what Nigerians desperately needed to calm the arising panic the moment the coronavirus broke through the borders of the nation. With only a team of about 200 staff and volunteers, NCDC deployed an emergency operations center as its epidemic intelligence structure to combat what was fast becoming one of the most dangerous health events of this age.
The Emergency Operations Center is also known as Incidents Coordination Center. It has helped in preparedness for and responding to public health threats. We've established 23 public health emergency operations centers in Nigeria. We've been able to build the capacity and capabilities of the frontline responders in all these states.
For the past 18 months leading to the COVID-19 pandemic, we had already been working and setting up structures. And one of those things was we are building a network of people with a reasonable level of infection prevention and control expertise all over the country. We had worked with the Nursing and Midwifery Council to train about 200 nurses.
One good thing that we did, before the COVID was we had trained all the states rapid response team. And now when I say rapid response teams, these teams are composed of a lot of professionals. We have doctors amongst them, we have laboratory scientists, we have the surveillance officers, we have the epidemiologists, we have others, nurses, that are trained to be prepared to respond to any epidemics.
So when we had the first case on the 27th of February 2020, we were actually out for it.
And so, starting with its surveillance and epidemiology pillar, NCDC set out to contain the first COVID-19 case and began contact tracing for the people the first patient had come in contact with. Sadly, the deadly virus that has led to the death of thousands in the Western world began an exponential spread from Lagos to other parts of Nigeria. As the death toll and number of infections grew, so did the fear in people. In a bid to contain further infection, the federal government resorted to drastic measures, shut down the borders of the nation, halt local transportation systems, lock down schools, offices and businesses, and promote social distancing and hygienic practices among the residents.
The priority is first of all to try to control the spread of the coronavirus by all means possible. Contact tracing, isolation where you can find them, and then treatment of those who require treatment. The other priority is morbidity and mortality. You want to make sure that you're able to take care of those who are fallen sick and look after them properly so that you don't lose too many lives. And then the third priority is, of course, protecting your the vulnerable ones, because we know that most of the fatalities are around people who have pre-existing illnesses and those who also are above a certain age.
With the mandatory shutdown in place, NCDC activated its dynamic EOC, a viable system designed to ensure seamless operation and coordination of all units, ministries, departments and agencies, MDAs, and development partners involved in curbing the spread of the deadly disease. This is in keeping with NCDC's mandate of leading and providing guidance, technical and logistic support to the states and local governments for tackling infectious disease outbreaks such as the coronavirus.
Health is something we call the concurrent list in Nigeria. It means that both the federal and state have responsibilities in providing health and healthcare for their people, but really the state is at the front lines. the state is directly responsible for the initial response, the initial detection, initial outbreak response. Our role as a federal government agency in the Federal Republic is to support the states. So whatever we are doing at NCDC really has to be through the states.
We provide guidance to the states on how to go about prevention, detection, diagnosis, and response to any outbreak diseases all over the country. We allow them to be in charge. Our hold is just to be behind while they drive the course.
I am happy today that this Public Health Emergency Operations Center, we have them in all the states. And we have all the gadgets that makes EOC to function very well in different states in terms of engaging them, knowing what they're doing, interacting with them.
We have a structure that is in place for disease reporting, and we have a strategy that we use that's integrated disease surveillance and response. It's IDSR, it's called IDSR in short. It's actually a strategy that the WHO African region is using. We have the application, the software we can use for real-time reporting, and it's called SOMAS.
SOMAS stands for Surveillance Outbreak Response Management and Analysis System. And as the name implies, this is an e-system that has been designed following the principles of the IDSR framework, which is designed to support surveillance, routine surveillance, as well as outbreak response. So SOMAS has been designed with a mobile application as well as a web application to capture this information from the grassroots level, and also to help them make sure that interventions that come from NCDC reaches to those levels, especially in the area of technical expertise, because we're bringing in something that is different from what is the usual. We have brought in electronics to replace paper. So the system helps us to bridge the gap of timeliness, as well as ensuring that the information that comes is verifiable and accurate.
While Chinedu and other members of the surveillance team work at detecting, preventing, and controlling the spread of this communicable disease, the team of scientists at the laboratory labor tirelessly to coordinate, collect, and analyze collected samples from suspected cases.
The purpose of the lab people is to help in the collection of samples and train personnel on how to collect the samples and ensure that the sample collected were confirmed and the results were released at a very possible short time.
Then the other bit is a strong network of labs that are hubs to the National Reference Lab. And the major reason for that really is that Nigeria is a big country. It's difficult to have one lab covering the entire geography of the country as it is, and for various diseases. So one of the things that we have done is to partner with institutions, agencies, and other labs that have capacity to diagnose and bring them together into a network that functions as one. So the whole idea is you have a strong coordinating center, which is the reference lab, and all of the other labs work like spikes around it, so sort of like a hub and a spoke mechanism, reporting directly and feeding directly to NCDC through the National Reference Labs.
We run a 24-hour service. We have 2 shifts. Since we started, we have not shut down for one day. It hasn't been easy, just to say the least, because you're talking about time, you're talking about resources, you're talking about commitment. Our slogan is to keep pushing.
But these selfless people are not the only frontline heroes battling COVID-19 in Nigeria. Thousands of doctors, nurses, psychologists, first responders, and risk communicators work tirelessly to stop the spread of the worst pandemic the world has seen in the last 100 years.
For managing cases, it has been challenging, both at the coordination part at NCDC and clinicians and health workers actually working on the front line. Some of them, they don't even go to their homes at this period, and you can know the emotional toll on that. A father, a mother, not seeing the children. The other fear is, I hope I don't also get the COVID. Tragically, well, some of them have had a heart infection. Several of them have recovered. We have a few persons that actually died. By and large, for those in treatment centers, it hasn't been high because there's been a lot of training on infection prevention and control.
We are working closely with all the facilities and the treatment centers that are managing cases. We try to provide support. We try to ensure that, one, they are adhering to the guidelines, two, the management that is being taken on these cases are actually standard and good enough, and ensuring that everyone gets the adequate care that they require. We try to see how states are also developing or trying to expand their case management aspects, so which is in expansion of bed capacities, expansion of trained healthcare workers, having a pool of doctors and nurses that have been trained on case management, ensuring that even severe cases can be managed at some of these treatment centers.
We also ensure that the lab reagents and the commodities that they use for lab testing are deployed to the states appropriately and in the right quantities for use at the states, and to give back information that will inform decision making at the agency. We also support health emergency response because the responders have to go with personal protective wares that keep them safe while doing their work. And we support the states with personal protectives that the healthcare givers use at the states to address public health events.
That has built confidence, at least for health workers. So we see that as a success for us in Nigeria, and in fact the African continent. Our case fatality ratio is not that high. It's 2.5%. If you look at the global figures, it's at 5.5%, meaning that we're having more successes.
Successes resulted from teamwork, relentless sacrifice, and NCDC's viable public health emergency response system. But the agency also attributes its achievements in responding to the COVID-19 pandemic to the remarkable support it got from several partners and stakeholders.
COVID is a global issue, a response that is beyond any nation. And so on this one topic and this big issue, Nigerians have come out well. The private sector, the car COVID, individual, even small private sector organizations have come out to provide their support.
The support varies from playing a coordination role to building capacities and providing guidance and standard protocols, including the provision of the needed logistics and supplies, such as testing materials, reagents, and personal protective equipment when needed.
We've received a lot of support from other partners, and that is why we're able to deal with it. From February to date, we have procured not less than 20 additional vehicles, all in an effort to deal with this dreaded disease called COVID-19.
It doesn't matter what bits and pieces individual organizations can bring. It's all part of the partnership. And what would happen post-COVID is seeing how we can organize that help and put in systems that will help us to make this routine, not only at the national level, but also at the state level.
As the federal government gradually eases the guidelines for lockdown and safety measures across the nation, NCDC still encourages people within the borders of Nigeria to diligently adhere to the safety guidelines which are necessary in ending the pandemic. And as it looks to the future, NCDC is committed to reviewing its current response strategies and building more efficient ones to better tackle subsequent outbreaks.
We have done well in so many areas. There are also areas where we didn't do well, and that is why we keep getting feedback. Before this outbreak, we had some structures in place. We had a system like the incident management structure that was already in place. We had surveillance at our points of entry. We had partnerships, we had collaborations. All these helped us. But there are also many new lessons that we are learning from this, especially as it pertains to the politics of health and how to engage communities how to communicate risk. We are learning a new strategy. We are moving from this top-down approach to a bottom-up approach, where the communities are allowed to drive their own risk communication processes.
We've learned a lot of lessons. It has helped us to improve on our infrastructure. It has helped us to realize what we didn't have, and we now have them in place. And we're not just stopping here. We know that anything can happen now, so government will be more determined in allocating more resources to the health sector. Private sector now realize there are responsibilities. They also have a corporate social responsibility to render, because a lot of them came forward.
I think the one thing this outbreak gives us is a realization by everyone across government and across society how important health security is to our national corporate existence in the long term. I hope that this will finally enable the investments that we need to make in public health, in our diagnostic capacity, in our treatment capacity, in our prevention, in vaccines, and in building the architecture that we need to invest in public health.
There are ways NCDC has tried to put this in place to ensure that future outbreaks are well prepared for and will be addressed adequately. The ReadySafe program is presently providing 100 million naira to the states to address different arms of the work we do. And World Bank is also preparing another loan, which they've named the co-prep. This co-prep will go a long way to prepare Nigeria for the future. The funds will be $100 million to be given to states to help them put the hospitals in order, put equipment in place, train staff, buy commodities for addressing outbreaks, and just be sure that we're there before the next outbreak.
At the beginning of this outbreak, we had just 5 molecular laboratories that could test for COVID-19. And currently we have over 40 of them in all the geopolitical zones of the country. We started with just one treatment center that was ready to admit a COVID-19 case that was in Yaba, Lagos, the infectious disease hospital. But currently we have over 150 and they keep increasing by the day. We now have more states taking responsibility and driving the processes themselves, setting up these treatment centers, putting up infrastructure for molecular laboratories. So I foresee a brighter future.
In NCDC, we have a slogan that is keep pushing, and we all keep pushing to ensure that Nigeria is better for it. So please, Nigerians, look towards the future with great hope. We're there for you, and we know you're there to cooperate with us and ensure that we get it right. Don't be scared of COVID, but please be very careful. Do the needful. Make sure you wash your hands. Make sure you use your sanitizers. Maintain your social distances, and ensure that you ride above COVID, because we're all going to ride through that and be above it.